Thank you, Madam Chair. Kathy, the most recent one, Initiative 502, and the stores and the system associated with that kind of put it under the regulation of the Liquor Control Board and was pretty tightly regulated on a whole myriad of things, labeling, packaging, testing. How does that compare to the current medical market that we have in place?
So I-502 does not apply to the medical market. So recreational users or the recreational sale of marijuana are subject to the regulations adopted by the Liquor Control Board. There are no equivalent regulations for the medical market.
And who regulates the medical market?
The medical market is not regulated.
Okay.
Of the 20 some odd states who have medical marijuana programs, how many of them do not have a registry?
They all have registries.
Except for us.
Except for us.
Thank you.
My name is Jessica Tanani, again. My main concern with the current medical market is the lack of quality control and dosing standards. The diversity and the quality of the dispensaries and growers is very significant, and the patient, I think it is very hard to comprehend these discrepancies. When we first began our biotech company, we had the idea of performing clinical observation studies on patients using specific strains of cannabis. We opted for a strain called Harlequin because of its popularity in the medical community. We purchased Harlequin products from several dispensaries and performed analytical testing on the samples. Comparing between samples, we saw as high as a 4,000% variability in CBD levels. Many dispensaries will pay to have analytical profiles run on their cannabis, which will allow patients to determine what medication is right for them based on the data, not a name on the jar. We believe this should be required for all dispensaries. Besides analytical testing data on cannabinoid content, we would strongly advocate for microbial testing and aflatoxin testing. We performed DNA sequencing of these samples we bought in the medical dispensaries and found a wide variety of microbial species present, many which are harmless, but some left us wondering how the cannabis was being handled. For example, we identified moderate levels of vaginosis on one sample, which is, well, exactly what it kind of sounds like.
And make a firm decision. We're going to either eradicate marijuana or we're going to sell marijuana. As far as the authorization goes, so I see your 16-year-old snowboarder and your marijuana authorization in a hemp vest tent, and I raise you state marijuana eradication program. You're going to have to decide. I'll take your legislation more seriously once you do that. It just makes it seem like you're not really serious about medical marijuana or even recreational marijuana, as long as you just can't tell law enforcement that they can't sign those federal grants. Authorizations. 4 years ago, they said we didn't have enough of them, and they expanded the amount of people who could write authorizations. So if you want to roll back that initiative and maybe cut back on some of the abuse, and how does that affect my rights as a personal home grower? Why did the storefront model have to spill over on me? Why do I have to lose my rights? Why did the cities ban residential collective gardens when they were operating as the legislature intended? You give them an inch, they take a mile, and the media's been real good at exposing our weaknesses and completely ignoring theirs. Thank you very much.
Thank you, John.
This is my 60-day supply that I showed Senator Rivers. This is a 75 plant, 48 ounce, 60-day supply, which says patient's condition requires 75 plants to maintain 48 ounces of usable cured cannabis. He is authorized to ingest, vaporize, or smoke it for tritation as he needs it. This is my medical record file that went through the Social Security system. This 60-day supply also went through the Social Security system and was testified to by a medical practitioner that was an expert witness that was hired by the federal government to come in and testify on my medical records and the recommendation was no pharmaceutical drug products for this patient. It is absolutely mandated that he uses the what they called
And I'm sorry, but I'm going to have to stop you. Time's up. Thank you.
Thank you for allowing us to testify today.
Thank you, sir.